am Perimenopause, 7 signs every woman should know. Have you noticed your period suddenly changing? Or maybe you're more irritable, exhausted, or waking up at 3 a.m. for no reason at all. You might be asking yourself, is this stress or is it perimenopause? Hi, everyone. I'm Dr. Rebbecca Hertel. I'm a board-certified osteopathic family medicine physician and a menopause specialist. And today I'm going to break down the 7 most common signs of perimenopause so you know what is happening to your body, what's normal, and when to ask for help. So here's the thing. Perimenopause isn't talked about enough. It can start in your mid-30s or early 40s. And on average, it lasts 4 to 8 years before you reach menopause. That means almost a decade of hormonal changes, and yet most women have no roadmap. I hear this all the time from my patients. Nobody told me this is coming. You're not alone. And today, we're going to take sign number 1, irregular periods. Cycles that were once like clockwork suddenly start showing up late or not at all. You might have 2 periods in a month or go months without one. Flow can also change, much lighter or heavier. And this all happens because estrogen and progesterone are no longer following their predictable pattern. For some women, tracking cycles in an app helps spot these changes early. Sign number 2, hot flashes and night sweats. You can get hot flashes years before your final period. They often will show up at night, leaving you drenched and exhausted. I like to call these super soakers. That's your brain's thermostat, the hypothalamus misfiring because estrogen is dropping. So tip, keep your bedroom cool, use moisture-wicking sheets, and know that medical treatments like hormone therapy are highly effective. Sign number 3, sleep problems. Does this sound familiar? You fall asleep fine, but wake up between 2 to 4 a.m. wide awake, or you have difficulty falling asleep and you just lay there waiting and waiting and waiting and watch the clock ticking and ticking and ticking. This isn't just stress. It's likely hormonal. Progesterone acts like nature's calming pill, and as it dips, sleep gets disrupted. Magnesium glycinate before bed, limiting alcohol, and practicing relaxation can help. But if it's constant, it's worth bringing up to your doctor. Sign number 4, mood changes. Irritability, anxiety, sadness, all can flare in perimenopause. Hormonal fluctuations affect neurotransmitters like serotonin, so your mood can swing sharply. And the life stressors of midlife, the career, kids, aging parents, it's a perfect storm. If you feel like you don't recognize yourself some days, that's a red flag that it could be hormonal. Sign number 5, brain fog. Ever walk into a room and forget why or lose your train of thought mid-sentence? I do. That's perimenopausal brain fog. Estrogen has a direct role in memory and cognition. Oftentimes, women will tell me that they can't do their job, that they used to be super sharp and now they can't get through sentences in a conference or during their work day. They oftentimes will forget what they're going into a room for. They'll forget names of people they know. Most of the time, these women will come to me in fear that they have early onset dementia, but it's really perimenopausal brain fog. And the good news, it often improves with lifestyle changes, sleep, and sometimes hormonal therapy can help as well. Sign number 6, weight and body changes. You might notice your clothes fitting differently, even if your habits haven't changed. Metabolism slows, muscle mass declines, and fat redistributes to the belly. With aging, we get loss of muscle mass. This isn't your fault. Strength training is very, very important to maintain muscle mass. Protein and sleep are your allies here, not your crash diets. Sign number 7, libido and fertility changes. So your sex drive may dip or intimacy may feel different. At the same time, you can still get pregnant in perimenopause. This is really important because ovulation doesn't stop until menopause. So you have to make sure, my perimenopausal women, if you have a male partner in your life, that you are using contraception in any type of form so that you do not get pregnant if you do not want to. If libido changes are bothering you, know there are solutions, from addressing vaginal dryness to exploring hormonal and non-hormonal options. So let's recap. If you're between 35 and 50 and experiencing things like irregular periods, night sweats, poor sleep, mood swings, brain fog, body changes, or shifts in libido, chances are it's not just stress. You may be in perimenopause. So what's the key takeaway? You're not crazy. You're not broken. Your hormones are changing. And with the right knowledge and support, you can absolutely thrive through this transition. If this video helped, make sure that you hit subscribe. I share weekly tips on thriving in midlife, from hormones and fitness to intimacy and reinvention. And don't miss my next video, Hot Flashes at Night, why they happen and what really works. And trust me, you'll want to watch that one if sleep is your biggest struggle.